Just Marshall here. Welcome back to the Realignment. This week, we're recording on Friday in the afternoon, all about the coronavirus. Sagar won't be joining us because the remote economy that we've all shifted to has made it so everyone's schedules are super difficult. We really appreciate you guys sticking with us. This is a really important conversation. We have Hudson Senior Fellow Tim Morrison, who is a recent veteran of the Trump administration. He worked in the National Security Council where he was working on biodefense and counterproliferation issues. So he's exactly the sort of person who we'd want to bring into this conversation. Tim recently testified before the U.S. Senate Committee on Small Business and Entrepreneurship on the topic of not only the coronavirus, but how the actual outbreak affects our economy, how it affects our society, and how we should really consider how US companies and manufacturing capacity when it comes to important things like healthcare, when it comes to our actual Tylenol, acetaminophen, how we actually are able to produce those things, not simply become reliant on, frankly, the country where this virus originated from. So really great conversation. Thanks for sticking with us, and we'll dive right in. Tim Morrison, welcome to the Realignment.
Well, thank you very much for having me.
So we wanted to bring you on the show. Actually, there's no we here because I'm the only one testifying with you here. Sagar was caught in the remote work coronavirus separation situation. But I wanted to talk with you because yesterday you testified before the U.S. Senate Committee on Small Business and Entrepreneurship, and you were focusing on the topic of the coronavirus and the broader implications for America's small business supply chain. What was your talk really about, if you could sort of summarize that?
So there were any number of experts, public health experts, experts on small businesses and how government helps small business. That was not an expertise I brought to the panel. What Senator Rubio and his staff asked me to do was essentially explain how we got here and what's this overall ecosystem. So we're looking at this problem. We're all trying to understand where we're going with the coronavirus pandemic. And one of the questions is how we got there. How did China let this get so far out of control before the rest of the world knew about it and was able to take care of its populations, take steps to prevent disease spread? But then also the discrete problem of what is becoming a more well understood reliance on China for basic healthcare commodities, for pharmaceuticals, and everyday medicines, whether it's an antibiotic or basic Tylenol, vitamin C. I don't know about you. Every time I feel a sniffle, even before coronavirus, I'll pop an Airborne.
Yeah.
And try to supercharge my immune system. Well, vitamin C isn't made in the United States anymore, unless it's like a Florida orange. Basic vitamin C supplements. The product is manufactured in China. China decided to control vitamin C, and so there's actually a vitamin C consortium because of Made in China 2025. So trying to help contextualize how we got here from the macro China problem to the micro, disease outbreak in China. That was sort of the expertise I tried to bring to the panel yesterday.
So before you came to Hudson in January, you actually led a team at the White House National Security Council focused on counterproliferation and biodefense. So sort of what was your role? What did your role involve there?
Well, and so you're actually touching on a bit of a sensitive spot for me because I have been at risk of throwing things at my television every time I hear somebody on the news, whether it's a presidential candidate or otherwise, say that President Trump dismantled his pandemic preparedness team because it's factually untrue. I led for a year. I led the Counterproliferation and Biodefense Directorate, so we had the responsibility for coordinating the government response for matters related to biodefense. So we issued and drafted for the president and for the executive branch what we call National Security Presidential Memoranda 14, which is a mouthful, but that's what we do in government, which implemented the National Biodefense Strategy, which is a strategy that we drafted for President Trump, and that was released in late 2018, which was something that I remember clearly because, and it's sort of instructive for where we are today. We released it in 2018. We released it on an anniversary of the anthrax attacks on the Capitol in 2001. It was, I think, 17 years to the day, in fact. And
did you work at the Capitol when that happened?
I did, actually.
Okay.
We released it in the centennial year of the great influenza pandemic of 1918. And obviously we're in a pandemic environment now, nowhere near as deadly, knock on wood, time will tell, as the influenza pandemic, which killed tens of millions of people around the world. And that's in 1918. If you project that out for what today's population is, it was one of the most significant pandemics that frankly struck the world, since the Black Death in Europe in the Middle Ages. And so I led the team that drafted that strategy. I led the team that drafted an influenza executive order to try to modernize how we respond to influenza, because one of the things we're going to deal with here when we talk about getting a vaccine, one of the delays in getting a vaccine under traditional vaccine manufacturing techniques is we still make vaccines in eggshells. We inject the vaccine strain into eggshells so that the serum can essentially be cultivated. So that is an ancient technique for making vaccines, but that's still what we do. So we drafted an executive order to try to modernize how we make vaccines, and we dealt with the Ebola outbreak in the Congo, which there was a famous Ebola outbreak in 2014 in West Africa. The difference between West Africa and Congo is essentially lawless. The parts of Congo are effectively fighting a civil war against their government. And so we were trying to deal with an Ebola outbreak in a part of Africa that was probably the most insecure place on earth that an outbreak has ever been contained. But you know what? We helped to do it. I was just a member of a team. My role was to coordinate. But the idea that there was no pandemic response team at the White House because President Trump tore it down is just categorically untrue. And there's the data points of proof that I just walked through briefly.
So what I'm always interested in is in any sort of disinformation spread, there's usually some grain of something that actually happened here. So if everyone on the campaign trail is talking about this, people in the media are saying the team was dismantled, what data point are they looking at? Like, so where did this narrative just emerge from?
So one individual was sent back from the White House early on their detail. Most of the people at the NSC, the National Security Council, are serving a short-term, 1 year, maybe 2 year detail where they're assigned from their home agency, the Department of Defense, the Department of State, and they are reassigned to the White House to serve on the president's staff as a member of the National Security Council staff. During the Obama administration, there were actually probably about 400 of those people. It was way too big. And so Congress, on a bipartisan basis, came in and told the Obama administration, you have to downsize the size of the council staff. It's too big. It's too operational. The National Security Council staff should be coordinating the government, not operating the government. We have cabinet secretaries. We have Senate confirmed officials to do that. So the Obama administration and then the Trump administration inherited a mandate from Congress to reduce the size of the council. One of the ways it was reduced was to fold in to another directorate, the Global Health Directorate. So the Global Health Directorate was folded into another directorate, and that became the Counterproliferation and Biodefense Directorate that I headed. One individual was sent back from their detail early. The Washington Post decided to run a story, trying to create a story around one person. And so there's this bad information, this bad press report that was put out that was never effectively fact-checked. And so this became a data point for an opposition researcher to fold into the talking points of a political campaign, because there's a sense of maybe we can score cheap points against the president. The idea that office that those experts were sent packing is just untrue. I led that team. There are still some of the smartest people in global health, in epidemiology, in biowarfare that the government has serving at the White House, working incredibly long hours right now to try to help keep us all safe.
So that basically takes us back to yesterday, which is, the testimony you gave. And it's really about tying the outbreak, because it originated in China, to sort of the actions of the Chinese Communist Party. Could you speak sort of about the controversy over the origins of the virus and the role that the CCP played in covering up, either through social controls or their control of social media, the actual outbreak when it started in December?
The Yeah, I mean, I think basically where we are is you go back to we've all heard of the case of Dr. Li Wenliang. I'm probably mispronouncing that. But this is the doctor who first sort of raised the alarm about coronavirus. And, we know that he died tragically. We know that he was detained by the Communist Party officials because, he was spreading the truth about the spread of the disease in China. And he was actually, the way they caught him was he was on a WeChat. So think of your think of your Signal app, think of your WhatsApp app on your phone or your computer. Well, WeChat is the Chinese Communist Party approved version of that because, of course, there's not a real internet in China. There's a Chinese internet that the Chinese Communist Party can control. And so WeChat is effectively controlled by the Chinese Communist Party. And, the doctor had the courage to tell the truth, and it was a truth that the Chinese Communist Party didn't want to hear. And so, he wound up getting detained. He had been exposed to the disease. He was in a Chinese prison, and he died tragically. And even today, there are press reports about ongoing censorship. The inability to send messages on WeChat that use terms that the Chinese Communist Party has banned. And at the same time, we're seeing all these reports in Chinese media about maybe the coronavirus was created by the US Army. Maybe coronavirus was created by the United States. The idea that this is not sanctioned by the Chinese Communist Party, this disinformation, at the same time, they're concealing factual information about the disease spread from the Chinese party, from the Chinese people. It just speaks to the insecurity of this regime. Everybody marvels about the ability of the Chinese Communist Party to build a hospital in 6 days. They marvel about the ability of the Chinese Communist Party to quarantine 60 million Chinese citizens. But this is a fundamentally insecure, oppressive regime that is afraid of its own people, and it's afraid of information. And that's unfortunately, tragically, what we're seeing here today. And I spoke to this in my statement yesterday. One of the reasons we are where we are is because the Chinese Communist Party concealed the fact of coronavirus from the world for effectively 5 weeks. The World Health Organization has detailed that they didn't get really substantive data from China until effectively January 11th. When they got that data, it showed that the first cases of coronavirus were charted by the Chinese health authorities December 8th. So between December 8th and January 11th, this disease was spreading across China, and they weren't telling the rest of the world. How many flights could we have stopped? Mm-hmm. How many flights worth of passengers could we have put through basic healthcare screenings, take their temperature, in that approximately 5 weeks? And I asked the question, and I don't think it's hyperbole, how many people have died in the United States because they were exposed to a relative who just traveled to China, or were exposed to a relative who associated with a person who just traveled to or from China, and didn't know to ask, am I sick?
Yeah, and that you have situations like Washington, the state where the virus spread for weeks before anyone had any context, and it seems clear that that sort of transmission system, that's where you sort of see the dynamic of December to January playing out. What do you think of the naming controversy of the virus, right? So you're sort of seeing this online slash media kerfuffle over terms such as the Wuhan coronavirus, Chinese coronavirus, as opposed to the sort of, COVID-19 scientific designation. Does that debate matter? Like how do you refer to the virus when you're speaking about it in public?
I refer to it as the Wuhan virus or COVID. The great influenza pandemic of 1918 is also referred to as the Spanish flu. I haven't heard anybody in Spain complain about that. This is an example, I fear, of wokeness getting us all killed. Because if we can't speak clearly about a disease, a pandemic, if we are too focused on playing games about what the name of the virus is, there is no question it originated in Wuhan, China. Why this is even a controversy? I just fear this is an example of wokeness getting us all killed.
I think what's interesting, what you're getting at in your remarks, is the point that I think there's this sort of narrative emerging with the building the hospital in less than 10 days and the social controls, that authoritarianism is inherently being sort of shown to work in this system. But to your point about social media controls and disinformation and repression of basic facts and speech, I think that sort of illustrates the fact that actually, like in a society like such as ours, you wouldn't have been able to keep basic facts like this under wrap for a month. So I just think that's sort of important to know that to get out your point that there's a direct tie between the authoritarianism of the CCP and the fact that society wasn't able to control this for over a month. So I think that really it's important to highlight that.
Yeah, I mean, I made a comment earlier that this is, the way they are censoring their people in China, the way the Communist Party is doing it. I mean, this is speaks to the insecurity of the regime. I don't think it's any coincidence that this kind of controversy is coming. I think it's being pushed by the Chinese Communist Party and its enablers. They don't want people to associate this virus with China. That's why they're spreading misinformation that maybe the U.S. Army created this. They are trying to confuse people about a crisis where people are dying. It speaks to the insecurity of their regime. The Chinese Communist Party knows it is an immoral, illegitimate government, and this is the kind of thing they do. I mean, if I think we've all probably read Orwell's 1984. This is what Orwell was talking about.
So I think something that ties the conversation about the nature of the CCP, its regime, and its control over their economies. It relates actually to our healthcare and medical system. So you're writing in well, you're also speaking about, but you've also written previously about the fact that the Chinese government, because of the fact that you really can't separate companies or sort of market actors from that government, actually have a large amount of leverage over our healthcare system. So could you sort of speak to what that leverage looks like today? And then after that, sort of explain how we got to that point.
Um, this goes back to the Made in China 2025 system. I mean, we refer to China Inc., China Incorporated. We refer to state-sponsored capitalism. The Chinese decided when they drafted their Made in China 2025 plan that there were strategic sectors they wanted to dominate. One of them was pharmaceuticals. It was healthcare. And so everything from penicillin to vitamin C, we like to talk about how much good capitalism has done to raise how many people out of poverty, and that's all true. It has done more to raise Americans, to raise poor around the world, including in China, out of poverty. What the Chinese do is they defeat the free market. They distort the free market. And so if you are an American corporation and you have shareholders to which you have a fiduciary obligation, and the Chinese come to you and they say, look how cheap our labor is. Come build your factory here. You almost have an obligation to do that. You have an obligation to your shareholders. Now, what is your long-term obligation to your shareholders when the Chinese show up in 5 years and they show up with a competing Chinese company where they have stolen your intellectual property and they've stolen your, your plant manager and your engineers who know how to run your plant, and they put you out of business, which happens every day. That is also an obligation to shareholders, but it's the difference between long-term obligations and short-term obligations. And it sort of speaks to how you compensate your executives. If they are compensated for a short-term bump in share value versus the long-term interest of the company, the Chinese distortion of the free market also distorts incentives for our companies.
Yeah, and it's sort of how. So, I mean, you referenced in your testimony that there's a lot of controversy over the American response to this distorted market because some people are advocates of what's called industrial policy, aka the American state sort of. Well, let's just put it simply. How would you define industrial policy, which is one sort of response to Made in China 2025?
Well, so I think this is. I think this speaks to maybe the way I look at things is different than the way other people look at things, because I spent the better part of my career working in the national security space. So what that means is um, I'm used to dealing with the Department of Defense. The Department of Defense has a tool called the Defense Production Act. If somebody isn't making a widget that's important to the Pentagon because it goes in a fighter jet or it goes in a satellite or it goes in a rifle, the Department of Defense has this pool of money to pay an industrial partner to build a widget because there's otherwise not a market for it. Thankfully, there's only so many people who build satellites, right? And there's only so many people who build tanks. And so, the Department of Defense has long been comfortable with, a unique relationship with its industrial partners. And so I certainly would not argue for a total decoupling of our economic interrelationship with China. I don't worry about China manufacturing sneakers. I don't worry about China manufacturing sponges or t-shirts. I worry about China manufacturing components of the F-35. I worry about China manufacturing and having, frankly, the monopoly on 5G because of Huawei and ZTE. And the fact that there's really no American companies left in this space, at least in the traditional way that they were there in 3G and 4G. And so, while not worrying about a full decoupling, I think there are certain strategic sectors where we can't afford to rely quite so much on China. And from my way of thinking, I would take the Made in China 2025 plan, I would turn it inside out and say, okay, these are the sectors where we need to have a strategic level discussion across our policymakers. Can we afford to have most active pharmaceutical ingredients made in China? Can we afford to have telecommunications like 5G essentially made in China? And if not, what are we prepared to do about it? And so that industrial policy may be, and this gets to the pharmaceutical industry that we were speaking to yesterday, maybe when it relates to the Department of Defense TRICARE program, which has several million beneficiaries, maybe when it gets to the Department of Veterans Affairs, which probably has about 10 million beneficiaries, maybe when it gets to Medicare and Medicaid, we will use the tremendous market power that we have in the United States, tens of millions of healthcare beneficiaries, and we will only buy their drugs from American and trusted allied companies. So I wouldn't lose any sleep about South Korea manufacturing penicillin for us. Now, the thing we have to understand is even our allies have to, especially because they're democracies, they have to take care of their own people first. So South Korea has had a COVID outbreak, obviously. And if you are going to be okay with some of your healthcare commodities being manufactured, even in an allied country like South Korea or Japan or Britain, you are accepting a risk there that even in an outbreak like COVID, a benign motivation where they have to take care of their people first could mean we would lose access to something manufactured there. So maybe we do want, in the case of pharmaceuticals, we want to have US capacity. Maybe that's different for pharmaceuticals than it is for 5G, because it's tough to foresee a crisis like a pandemic where it's really going to be that big a deal if they cut off the supply of a router,
Yeah.
modem to the United States. But the risk that we're taking when we rely so heavily on China is the malign motivation. We've seen Chinese state-owned media say that if we upset the Chinese Communist Party right now, they will bury us in a mighty sea of coronavirus. Many of us in the national security space saw a wake-up call when, because of a territorial dispute between Japan and China in 2010, where a couple of fishing boats crashed, Japan took certain steps to essentially punish China. And China said, well, you know what? You get all of your rare earth elements from us. We're going to cut you off. And they did. And major industrial plants in Japan were idled for months because they just simply didn't have rare earth elements. So imagine a scenario where we take some step that angers China in the future. Maybe we send the Secretary of State to Taiwan, because you know what? They're a vibrant democracy and a major industrial partner, and we won't be dictated to by China over where we send the Secretary of State. Well, the Chinese might respond and say, well, you know what? I hear it's a really bad flu season, President Trump. I hear it's a really bad flu season, Secretary Pompeo. We really didn't appreciate you sending your senior official to Taiwan. You're probably not going to get any Tylenol and any penicillin for the next few months. Sorry. That's the kind of thing that we are exposing ourselves to. Are we comfortable with that?
Yeah. So I guess my last question would be, there's a lot of debate about how our country's going to handle the coronavirus, but what I've liked about our conversation is you've focused on the structural factors that produce the situation we're in. What do you think, if you were to sort of look at policymakers and also, frankly, corporate leaders, civil society, the media, et cetera, how should they be thinking about all these issues? So for example, how should the media cover matters like, the Washington Post thing you were highlighting? How should companies consider their decision to center their production in China? How should the government consider these questions of innovation versus state support? Yeah, and I'm looking for a broad thesis, of course. It's I don't need an exact play, because I think the thing I'm trying to get across is this is an issue where you're sort of seeing it's completely intersectional, to borrow a term from the left, right? You have every single part of our societies having to have some sort of response to the epidemic, and it's not quite clear that the leaders or factors within know exactly what they're doing.
Yeah. So, I think one of the things that the Trump administration got right was the national security strategy of I guess it was 2017. I think it was December 2017. And what the administration did, which previous versions of similar documents from previous administrations, like in the Obama administration, what they didn't do was the Trump administration said, we are in a period of strategic competition again. We have a great power peer or near peer rival called the People's Republic of China. And that was important because I think most people, they heard bad things. China's doing this, China's doing that. I don't understand what it means. We defeated the Soviet Union. That was an existential threat between two competing ideologies for 7 decades. And so we just sort of drifted along in the 90s and the 2000s. We had the peace dividend. We were woken up from our sort of, our sort of paradise by 9/11, obviously. But those are a bunch of terrorists running around a desert. That's really far. That doesn't fundamentally threaten our way of life. But then the national security strategy says, well, you know what? Actually, we've looked at what China's doing, and they are trying to displace us. They are trying to create a competing world system, and that does threaten us. And so I think where the administration didn't go as far as it could have is that should have been a strategy that should have had a series of speeches between the president and the American people, between our cabinet and the American people, to go out and explain what that means. Because you ask, what should that mean for business? What should that mean for press? You know, there have been articles, members of Congress have tried to call attention to the fact that, for example, the Washington Post, and I think the New York Times, you get your Sunday newspaper, you might find a very glossy, pretty enclosure that looks like it's news, but it's not. It's paid propaganda by the Chinese. That goes in your newspaper. Why is the Washington Post serving as a vehicle for Chinese propaganda and not really making it very clear that this is paid propaganda by the Chinese Communist Party? Shareholders, I made the point in my statement for the hearing. I think boards of directors are not paying close enough attention to what their corporate officers know, which is they're hiring members of China's Thousand Talents program. The FBI has warned about the dangers of the Thousand Talents program. They just arrested a Harvard professor because he was a Thousand Talents program member, and he was allegedly involved in the theft of R&D, I think it was from Harvard, related to Defense Department work. And so the Moffitt Cancer Center was receiving NIH R&D investments, and Chinese Thousand Talents program members were taking that R&D back to China. We were paying for the R&D, and they're going to profit from it because they didn't have to make the investment. Members of corporate C-suites are seeing examples of where they are losing IP to China on joint ventures, and they're not necessarily disclosing that to shareholders. And they're not necessarily disclosing that to their boards of directors. And so understanding that we are in a whole of society contest with the Chinese, and the whole of our society is going to have to be, for lack of a better term, enlisted in fighting back. I want to read just one quick quote because I think it's really powerful.
Yeah.
And it's the kind of thing I wish it was shorter in some ways, because I'd love to see it on every bumper sticker of every federal government, state government, local government vehicle. But I'm a nerd, so that's the way I think. But so Chris Wray, the director of the FBI, testified in February of 2018, and he said the following: "One of the things we're trying to do is view the China threat as not just a whole of government threat, but a whole of society threat on their end. And I think it's going to take a whole of society response by us." So what are the obligations among shareholders to hold their boards of directors and their corporate officers accountable? What are the obligations in college academia to understand the relationships they're making with the Chinese? What are the obligations in the press to ask the question when they're getting badgered by the Chinese embassy, when they're getting badgered by, Chinese reporters that, oh, you can't call it the Wuhan virus, that's racist. What's racist about saying where the virus came from? But that's the kind of thing that we're going to have to, everybody's going to have to realize their part. The Chinese are coming for us. And we all need to understand that a lot of the freedoms that we expect as our birthright, that we've been told because it's in the Declaration of Independence, it's in the Bill of Rights, it's our birthright, that's not the Chinese worldview. And if we think that they're not going to try to import to the United States their version, well, right now they're telling us we can't call it the Wuhan virus. What's next?
It's powerful. I mean, and I think that's actually the best way to end this. Which the question here is, what's next? It's clear that there are all these factors that have played together. I think the question for each of us in society, from our listeners to people at Hudson to members of Congress and the administration, is what are we going to do to respond to these questions? So, Tim, thank you so much for coming. Really appreciate it. And we'll definitely be keeping informed about the work that you're doing on this incredibly important issue.
I really appreciate it. Appreciate the time, appreciate the opportunity, and just remember to wash your hands.
Thanks for coming.
All right, thank you.
Hey guys, thanks for joining Tim and I for the episode. We're going to keep these episodes coming, even though we're going to be working remote for the next week or so. We think this is a really important time to sort of take a step back and focus on the deeper issues of people like Tim who are doing really interesting work. So as always, rate us 5 stars on Apple Podcasts and share this with your friends. We'll see you next week.